The broadcast is now starting. All attendees are in listen-only mode.
Well, good morning, everyone. This is Jay Ferris at Nebraska Farm Bureau. I'd like to welcome everyone to our webinar on navigating through the Affordable Care Act that is being sponsored today by the Nebraska State Chamber and also the Nebraska Farm Bureau. Just to give a little bit of an update, Steve can't hear me. You might have a volume control on your...
Just go ahead. Just keep going.
Yeah, okay. We're just going through little technical issues here, but just to give everybody kind of an update of what we're going to do during the webinar. If you do have a question, there is a question box that you can type in your question. There is also a chat function that you will be able to communicate with us. If you have a question or need to chat with us or ask a question, you can do the question button. There is also or you can type in your question. There is also a button to raise your hand. If I see a hand raised, I can unmute your line and then you will be able to ask your question. You do need to have a microphone on your end at your computer to be able to ask the question live like that. Otherwise, you'll have to just do it via typing in that question. With that, I will introduce Steve Kammeyer, who is with the Farm Bureau Financial Services, who will lead us through the presentation.
Thank you, Jay. My name is Steve Kammeyer. First of all, welcome everybody. It's a beautiful wet morning here in Nebraska. It's good to be here. Just a little background on myself so you know who I am. I'm the Director of Health Insurance Services for Farm Bureau Financial Services, which means basically I'm responsible for the health sales that our agents sell in about an 8-state area. That includes Nebraska. It also includes South Dakota, Iowa, Kansas, and a lot of your neighbors. What I want to do today is just kind of walk through the Affordable Care Act or the ACA or Obamacare or PPACA or whatever we want to call it today, and just give you a little bit of an overview of what's going on, to give you some background in terms of what's already happened, also to give you some background really on what's going to be coming. I'm trying to get my slide to advance here, so if you'll hold on just a second. This is our agenda. We're going to give a brief overview. We're going to talk about what's already happened with the law. In the individual market, we're going to talk about what's going to come. In the group market, we're going to talk about what's going to come. Most of my comments are going to be focused on the individual market. That's the market that we primarily work in. That's probably the market that impacts many of you. However, I do want to touch base on some of that small group stuff because a number of you may have small group plans or provide insurance for your employees. I'll provide a little wrap-up and question time at the end there, but certainly if you have questions as we go along, feel free to text those into the chat box. One caveat I want to give is I'm going to address kind of the health insurance issues here. I'm going to stay away from trying to give you tax advice. Each person's situation is kind of unique, and I will talk at a high level about things like subsidies and tax credits and other things, but I'm not going to get too much into the weeds. You really should be working with your accountant on those particular issues. So with that, let's just get started with a real quick quiz. And it's on the screen there. And it basically says more than 40 million people, or about 16% of the population, do not have this. And the biggest reason they don't have it is because they can't afford it. The costs are absorbed by those that do have it. And the average cost for an incident for someone that doesn't have it is about $11,000. So think about that for a little bit. And when I typically do this slide, I get a whole bunch of people that raise their hand and they say, well, that's easy, it's health insurance. Actually, that's wrong. The correct answer is it's auto insurance. Even though every, with the exception of one, has a law that says you have to have auto insurance, and even though there are some fairly stiff penalties for not having it, I bring that up only because health insurance is kind of, in essence, going to be set up the same way in terms of people are now going to be required to have it. So let's talk briefly about the act itself or the law itself. The law was over 2,700 pages of legislation, and the key here really is there's over 1,300 places in the law that says something along the lines of the Secretary shall develop rules or the Secretary shall promulgate rules. What that means is the legislation, that 2,700 pages was just a tip of the iceberg. What we have gotten over the last really 3 years, 3.5 years since this law was passed is literally tens of thousands of pages of regulations. Some of those have been written for a long time. Frankly, some of them are still being written right now, and some of them are still up in the air. Some of this stuff has been delayed. But the bottom line is, and I get a lot of questions from folks that say, well, what happens if it blows up? Or what happens if it gets defunded? The reality of it is it's the law of the land today. So my job today is really to help you understand, okay, what does the law say? How do I have to comply with the law? And probably more importantly, how can I take advantage of the law? Not take advantage of in a bad way, but to make sure that I'm doing the right things for me and for my family to make sure we're in the right kind of coverage. So what's already happened? Some of these things you may be aware of, you probably are aware of, some of them you may not be aware of. But things that have happened already. You can now keep your children on your plan up to age 26, and that's regardless of whether they're a full-time student or not a full-time student. It actually is regardless of whether they're living with you or not living with you. It doesn't matter if they're married or not. You can still leave them on your plan. We've eliminated, or the insurance companies have eliminated, the lifetime benefit provision. So there used to be policies out there that would have a $2 million or $5 million or $10 million lifetime maximum. The reality of it is very rarely were those maximums ever hit, but they've been eliminated. Certain preventive services are now covered at 100%, so that if you go into the doctor for your physical, your certain preventive services, depending on what age you are, those are going to be covered with no copay, no coinsurance. There's a prohibition against denying coverage to children. You cannot deny coverage, or an insurance company cannot deny coverage to any child that applies because of a pre-existing health condition. There are what are called minimum loss ratios, and what that means is it says the insurance company has to spend a certain percentage of the premium they take in on the claims that they pay out. In the individual market, that's 80%. That's probably a good rule. There were insurance companies out there that were running loss ratios in the 60 and 70% range. Most of the carriers we work with, we happen to work with Blue Cross Blue Shield here in Nebraska, really don't have any issues with this. Their loss ratios tend to run in the 80 to 85 to 87% range. But what it basically says is we don't want insurance companies making too much money. And then the last thing is a small business tax credit, and I'll talk about that in a little more detail when we get into the small business stuff. But basically it allows for small businesses that meet certain requirements in terms of workforce, in terms of salary, to be able to claim a tax credit for the premiums paid for their employees. That tax credit could be anywhere up to 35% right now, and in 2014 that moves up to about 50%. So what do all those have in common? Well, what they have in common is that they're all very consumer friendly. All those things for the last election cycle were all very consumer friendly. They did, frankly, very little to increase costs, and they're probably pretty good ideas. If the law were to ever be overturned, it's likely that these things would still stay in place because most of the insurance companies even agreed this was probably a pretty good idea. So let's dive. First of all, everyone's required to have what's called minimum essential coverage. It doesn't say everyone's required to have health insurance. It says everyone's required to have minimum essential coverage. And what that means is the government has said there's a certain level of benefits that you have to provide. And I'll talk a little bit more about each one of these as we go on. Having a little technical, there we go. Proof of credible health coverage is required for legalized citizens. Again, similar type. Everybody can get health. So it basically says the insurance company has to issue those contracts. There are what are called essential health benefits. There are limitations on when you can purchase insurance. and there's new ways to buy insurance, and there's new pricing structures. So what I want to do is really go through each one of those individually. So the first one is everyone's required to have minimum essential coverage. Basically, you're going to pay a penalty if you are uninsured. Today, you have the ability not to purchase insurance. You, in essence, self-insure yourself. But now there will be a penalty if you do not have minimum essential coverage. And the government, and I'm not going to get into all the details on how minimum essential coverage is defined, because most of the insurance companies are not going to operate or offer plans that don't meet that guideline. There are some exemptions from the requirement. You are allowed to be without coverage for a couple of months, for instance, if you lose a job or lose your coverage. But if it's more than a couple of months, you will pay a penalty for not having it. If there are certain financial hardship situations in place, and then folks that are, in prison right now, there's certain religious exemptions, etc. But for the most part, this requirement applies to everyone. Everyone can get health insurance. So these two are really tied together. One of the things that the law was designed to do was to say no one should be denied coverage because of any pre-existing health condition or anything that's related to their health status or their genetic testing or anything else. What the insurance companies were concerned about was, well, if anybody can get coverage and we're not allowed to underwrite, that's fine. We can manage that risk as long as everyone has to get coverage. If you had a scenario where not everyone had to get coverage, it was guaranteed issue if you wanted to get it. The only people that would ever apply for insurance are people that are sick or knowing they're going to go in for surgery or some condition, which would drive rates remarkably higher than what they do today. So these two things were passed in tandem. And again, what it says is you cannot be denied coverage for any pre-existing health condition. So these essential health benefits, in essence what the essential health benefits are is a group of 10 different coverages that are included in every single health plan out there. So regardless of whether you buy a bronze plan, a silver plan, a gold plan, and I'll talk about all those in a little bit, these 10 services are going to be included in that coverage. What that does is, in essence, standardize what's being offered in the marketplace. It doesn't say all these services will be covered at the same levels in every plan, but what it says is all these services will be included. The three biggest ones that probably aren't included all the time today are maternity and newborn care, mental health and substance abuse, and something called habilitative services, which is down there between prescriptions and lab services. Typically, folks have an option whether they want to buy coverage with maternity. Tomorrow, or starting in 2014, that's not an option anymore. That is required coverage. We joke a little bit about, if you're a 64-year-old single male buying coverage, do you really need maternity? It doesn't matter. It's going to be included in your plan, as will each one of these 10 essential benefits. The next slide it's a little more complicated, and I'm going to try to explain it to everyone. What it basically says is every plan has to fit into one of four categories: a bronze plan, a silver plan, a gold plan, or a platinum plan. The best way to describe this is, and I'm going to take the silver plan as an example. The federal government created something called the Actuarial Value Calculator. And what that calculator does is calculates based on the average cost that the average American has in their health plan. If we plug those into the benefits defined, what percentage of those costs are paid by the insurance company and what percentage of those costs are paid by the member. In the case of a silver plan, that plan, basically the plan will pay 70% and the member will pay 30%. Now, what I want to be careful that people understand is that does not mean it's a 70%, 30% co-insurance plan. There's a lot of plans out there that once you hit your deductible, you have co-insurance. This says if you take all of the benefits and combine them and put them together for an average person, on average, the insurance company is going to pay 70%. So what does that mean? What that means is for somebody that has a lot of health claims, and they hit their out-of-pocket maximum, let's say they have a major surgery, they have an accident, whatever it might be, the percentage of claims that they'll actually pay out of pocket is much smaller than that 30%. For the member that has very few health claims, rarely goes to the doctor, maybe fills 1 or 2 prescriptions a year, they're probably not even going to hit their deductible. They're most likely going to pay a lot more out of their pocket from a percentage standpoint. The reason that's important to understand is as you go into it, you have to understand there's still risk levels and out-of-pocket maximums on each one of these plans. And so as you go into it, really your risk is not in deductibles, in coinsurance, in co-pays, or anything like that. Your risk is your out-of-pocket maximum. So as you go in to talk to your agent, or as you're looking at plans on the marketplace, or however you happen to shop for insurance, what I encourage you to do is look at that out-of-pocket maximum. Once you hit that out-of-pocket maximum, that's the most that you will pay out of pocket. At that point, the insurance company will pick up 100% of the claims that you have for the remainder of the year. The other thing that's different about that out-of-pocket maximum is historically, some things have applied to it, some things have not. So deductibles typically did not apply to the out-of-pocket maximum. Co-pays did not apply to the out-of-pocket maximum. Only your coinsurance did. In the new world, anything you spend out of pocket, whether it's a copay for a drug or a copay for an office visit or your deductible or whatever it may be, that will apply towards your out-of-pocket maximum. So I know that's a little bit confusing, and certainly I'll answer questions as folks have them. There is a limitation on when you can purchase. If we had guaranteed issue policies and people could buy them whenever they wanted to, what you would end up with is people that would not buy a policy until they got sick. You would have telephones built into ambulances so they could call their insurance agent on the way to the hospital and say, guess what, I need health insurance. The insurance companies were terribly afraid of that, and therefore this provision was built into the law, which basically says you can buy a new plan or switch plans anytime during the annual election period. This year, that annual election period runs from October through March. In future years, it'll basically run from the middle of October till early December. And all of those apply to January 1 effective dates. Now, for this year, because it runs past January 1, if you don't enroll until, let's say, February 14th or something, you won't actually have coverage until March 1st. They will not retroactively put that coverage in place. The other time you can buy is during a special election period, and those are typically triggered by some type of life event. Those are things like you've lost your employer coverage, or your spouse passed away, or you got a divorce, or you had the birth of a child. That sets up a special 60-day period where you're able to buy insurance. But outside of those two periods, you can't just say, I'm going to go without insurance, and then in April change your mind and say, I'm going to go get some, because you won't be able to purchase it. So there's a new pricing structure in place, and I don't want to spend a whole lot of time on how insurance companies price their product, but I think it's valuable for people to understand kind of some of the rate shock that you're going to see especially in certain age groups. So first of all, there's single pooling. Today, most insurance companies will have multiple pools, and those multiple pools you could have one for individual business, one for small group business. You could have multiple pools for individual business, and some of the insurance companies have done that over the years. As one pool gets, quote, sicker, they develop a new pool, and if you were healthy enough to underwrite into the new pool, you could enjoy lower rates. If you weren't and you were stuck in one of the older pools, you tended to have significant rate increases. So the single pooling actually protects members from being stuck in those older pools, and it's probably a good thing. It's a good thing for the industry. It's a good thing for individuals out there. There's no longer rating for gender. So we can no longer differentiate between a male and a female. Well, if you look at the actuarial tables, a young female is tremendously more expensive to insure than a young male because they are in those childbearing ages, and young males typically don't have a lot of health expenses. On the flip side of that, older males are typically more expensive to insure than older females. We tend to develop health issues later in life. We don't go to the doctor as frequently as our wives and girlfriends do, and therefore we tend to get a little sicker. In the future, there's no variance in price between males and females. So I'll explain that in a little bit and how that's going to impact things. There's no rating for health conditions. So regardless of whether you're a 42-year-old that has gone through 3 heart surgeries, has diabetes, and is 60 pounds overweight, or you're a 42-year-old athlete that's never had a claim in their life, your rates are going to be the same. The last thing I want to talk about is this 3-to-1 rating limitation. Today, most insurance companies have roughly a 5-to-1 rating. And what that means is your most expensive person can be up to 5 times more expensive than your least expensive person. So in this scenario, a 64-year-old male might have a base rate of $1,000. A 26-year-old male may have a base rate of $200. So you can see that 5-to-1 ratio, 1,000 to 200. In the new world, in 2014, that is limited to 3-to-1. So the effect of that is the 64-year-old's rates probably go down a little bit, and let's say for this scenario to $900. The 26-year-old, because there's a 3-to-1 rating limitation, would probably move to about $300. So you still have that 3-to-1 ratio between $900 and $300, but the impact of that is that 64-year-old just saw a 10% decrease in rates. That 26-year-old just saw a 50% increase in rates. If you combine that with the fact that we no longer rate for gender, that 26-year-old male is also going to be paying for things like pregnancy and childbirth. I bring this up because there are certainly going to be winners and losers in this. If you're a 26-year-old male, you're not going to be a winner. These rating rules significantly hurt young males. They tend to help older males and older females, actually. And again, I don't want to get into specifics because depending on which plan you choose and what coverage you choose, it could vary differently in terms of how it particularly impacts you. There are a number of new government fees, and I'm not going to talk a lot about these, other than to say by the time you calculate all these fees, it's roughly about $15 per member per month, which means for a family of 4, there's roughly $730 in fees that are built in. These fees are designed to do a lot of things. Some of it is related to paying for the law. Some of it is relating to risk tolerance and what's called transitional reinsurance. Again, I don't want to get into a lot of detail on this. I can certainly answer those questions later. So one of the questions I get asked a lot is, how do I go about buying insurance? You know, I hear about these marketplaces. I hear about the exchanges. I don't understand what it means. There's really 2 ways that you can go about buying insurance. You can go about it the same way you always have, which is by going directly to an agent, and that agent can help you pick out a plan and you know, do what you typically do. Or you can go to the marketplace. The marketplace was originally called the exchange. They're the exact same thing. So what is a marketplace? It's basically just another way to shop for insurance. It allows a consumer, it's typically a web-based tool that the consumer can go out, take a look at all the different plans offered on the marketplace. And that doesn't mean it's every plan that's offered in the market. The marketplace is simply a place to shop. There are plans, these are not government plans. They're plans offered by private insurance companies. Those same plans can be purchased off the marketplace. The real kicker for the marketplace is if you qualify and if you want to apply for subsidies, it has to be done through the marketplace. So it's a good time to kind of take a step back and talk about subsidies because we haven't talked about it yet. The law basically is trying to make insurance affordable for everyone. So what the law has done is set up some context around who qualifies for a subsidy from the federal government to help purchase insurance. And the first criteria is, what is your family income? If your family income is somewhere between 133% and 400% of the federal poverty level, you pass the first qualifying step for a subsidy. 400% of the federal poverty level, for those wondering is about $90,000 for a family of 4. So there's probably a lot of people that will meet that criteria. However, there's a number of other criteria as well. Once you've identified what your family income is, based on that family income, there's then a determination made on how much of that you can actually pay for health insurance. And the maximum in that regards is about 9.5%, but it ranges all the way down to a couple of percent when you get to the real low income levels. So what that means is, let's say you made $50,000 a year, and the formula says, and you can pay 8% of that towards your health insurance. Anything more than 8%, you would qualify for a subsidy. So 8% of $50,000, if I can do my math right, is about $4,000. That would be the most you would pay for health insurance in that year. Now, having said that, there's one other qualifier, and if you think this is getting complicated, just wait. The other qualifier is it's based on what it would cost you to purchase the second lowest price silver plan offered on the exchange. And that silver plan could be a limited network plan, it could be a PPO plan, it could be any plan. It's the second lowest price silver plan. There's some other requirements in place as well. I'm not going to go through all these. And here's why. Because if you go out to the exchange, you're supposed to be able to plug in your data, and it will tell you whether or not you qualify for a subsidy. So let me hop ahead and talk about how it's supposed to work. And I do say supposed to work. There really are 4 steps. First of all, you have to create an account, which means you provide your name, your address, your email address, etc. It'll get you set up for an account. Then you can go out and look for coverage and apply for coverage. And that requires you to provide a lot more information. So it includes things like family size, social security numbers, employer information, income information for every member of your household, policy numbers for anything that you have. There's a lot of stuff that you have to enter. I would also note that the income that they're using to determine whether you qualify for a subsidy is not your income from the prior year. It is your estimated income for the coming year. So if you underestimate that income and you get to the end of next year, they can take those subsidies back. If you overestimate your income and end up making less, they theoretically can give you more subsidies. It's a fairly complicated process. I spoke to, and if you've been watching the news at all, you know that these exchanges are not working particularly well right now. I was talking to someone this morning, and we jokingly said that the government shutdown was a good way to keep the problems with the exchange off the front page because there's something else for the media to cover at this point. But when I talked to my friends over at Blue Cross Blue Shield of Nebraska, as of yesterday, they had a grand total of 5 people enroll through the exchange in any one of their plans in the first 2 weeks of the open enrollment period. So, you know, for those that aren't aware, Blue Cross probably has a 70% market share, so there's significantly more than 5 people that are out there probably trying. So, so now actually, let me talk a little bit about navigators. I didn't talk about navigators earlier. When you're out on the exchange, there's somebody called a navigator that can help you with that process. And the navigator is really just someone that's supposed to be able to help you walk through how to use the marketplace. They are not required to be health licensed. They do have to require or complete a certification, but they're not able to really help you in choosing a plan, or they're not supposed to be able to help you choose a plan. They really can't offer any assistance after you buy the plan at all. Whereas if you go to an agent, that agent is a licensed professional. They're licensed with the state. They have to pass continuing education credits. They have to complete certifications. There's all sorts of stuff that agents have to go through. And those folks can help you after the process. And while certainly I work for an insurance company and therefore our agents are near and dear to my heart, I'm not saying you have to go to see a Farm Bureau agent. I'd prefer that. But really, any agent that's certified to sell on the marketplace can help you with this. There's no reason that you should go out there and try to do this on your own. It can get incredibly complicated. So again, the marketplace, the advantage really is those subsidies. If you qualify for the subsidies, or if you qualify for Medicaid, that's the only place you can go to get that coverage. The drawbacks are they're not going to have every product out there. They're only going to have the ones that the insurance companies have decided to offer on the exchange. There's very limited guidance in terms of plan selection, and everything is web-based or phone-based. There's no personal interaction with anyone. Whereas opposed to with the local agent, obviously trained professional, they can look at your personal situation. They know you. You've probably worked with them on other things. You know, I'm not going to belabor the point. I think it's fairly evident why I think this is the best option. I want to spend just a couple of minutes on the group market. A lot of the things that we've talked about already apply to both the individual and group market. So things like essential health benefits, things like the platinum, bronze, gold, silver tiers. No longer can you deny coverage because of pre-existing conditions. But there are some unique things in the group market that I do want to talk about just a little bit, if I can get my slide to advance. So the essential health benefits we already talked about. There is a new pricing structure that's also in place. The new way to purchase health insurance, there is an exchange. It's called the Shop Exchange, and it's designed for small business. That was supposed to work much like the individual exchange works for individual. However, that Shop Exchange has been delayed, and I say partially delayed because you can still go out and buy insurance on this exchange, but you can only look at one company's plans. So it really doesn't provide a lot of benefit to the small employer. This was delayed about 3 months ago when it became very clear they were not going to be functional or operational for the January 1 effective date. The next thing which you may have heard about, and I've gotten a lot of calls about, is the employer notice of the marketplace, which basically says the Department of Labor and the Department of Health and Human Services put together a form that you are required as an employer to provide to your employees, which basically says there is the existence of something out there called the marketplace, and you have the ability to go out there and purchase coverage on the marketplace, and you may qualify for subsidies. It was kind of a way to force employers to tell employees about the fact that they do have options. That, while it hasn't been delayed, the enforcement of it has been delayed, in that the federal government has said we're not going to hold anyone accountable for this particular requirement in year 1, but we will in year 2. So it's something that you'll want to be aware of. If you go to the Department of Labor's website, they have standardized forms that you can provide to your employer or to your employees, and you have to provide these actually whether or not you're offering the coverage or not. So you have to provide these. There's different forms depending on whether you're offering them coverage or not. But as an employer, you have the responsibility to make them aware of the marketplace. The next thing is that there is no employee or employer mandate under 50 employees. So one of the things you may have heard about is it's called the shared responsibility or the employer mandate, which is any employer over 50 employees has to provide health insurance for their employees, or they will be forced to pay a penalty. There's a lot of employers that were doing a lot of HR-related gymnastics to try to get under 50 employees for the coming year because they didn't want to be subject to the mandate. The reality is this mandate also got delayed, and I don't have that in there, but they are not going to enforce this in year 1. And again, it became a function of what they could and couldn't do. What you'll want to do as you move into next year is you want to be thinking about, if you're anywhere close to that 50 employee level, you're going to be thinking about, how do I structure this? What do I offer in terms of benefits? And I would highly encourage you to work with both your accountant, your attorney, and your insurance agent on what you have to do in regards to this. There is a maximum 90-day waiting period, so a lot of plans used to have waiting periods where you had to be employed for 6 months or 4 months or whatever it is. The maximum you're allowed at this point is 90 days. And then the last thing is there are some limitations on some of those tax-advantaged accounts, in terms of how you can use HSAs and HRAs and FSAs to help fund health insurance premiums. I don't want to get into a lot of detail here. A lot of this is based on if your employees are buying individual coverage as opposed to group coverage. If you have a group policy, you still have all the same advantages you had before. But if you're someone who has a couple of folks working for them, you've always helped them with their premiums in one way or another, there are some limitations on what you can do in terms of those tax advantaged accounts. And again, I don't want to get into giving tax advice because each person's situation is really unique, and I don't want to be the one to tell you something that turns out to be wrong, but your accountant will be very familiar with these. So just to wrap up, and then because I want to make sure we leave plenty of time for questions. The ACA is the law of the land. It very well could get changed. It hopefully will get changed. Because of the way it had to pass, it's not the most eloquently written piece of legislation. In fact, it's rather burdensome in a lot of situations, and people know that it needs to be fixed. The problem is we have to get people to agree on how to fix it. The focus now should really be on, okay, it's here, how do we comply with it? We can't just stick our heads in the sand and say it's going to go away, because it's not. There are a lot of new options. There's new plans out there, there's new processes out there. In the state of Nebraska, basically almost everyone is going to be required to go on a new insurance plan on January 1. So it's important that you be working on that now, be working with your agent, be working with whoever it is that you work with. You can't just ignore it. So you can go online to the marketplace. You can go see your agent. I'm going to put in a shameless plug here and say go see your Farm Bureau agent. One of the things we've tried to do is really teach them all about this law and all the intricacies of it, so they can help you. Because at the end of the day, that's really what it's about: is how do we help our members, our consumers, our clients make the best use of the plans that are out there to help protect their families, to help protect their livelihoods. So with that, I'm going to take just a break here, and I'll turn it over to Jay. And
there is a question I sent you on chat, but we do have a couple of questions. But first of all, just to go back, if you do have a question, you can certainly ask that in the question pane, or you can raise your hand and we will turn your microphone on. The first question is from Karen. She wanted to know, excuse me, if you start out with the marketplace, get enrolled, and then next year wish to go to an agent, will this be allowed, and do you have to apply each year?
It would be allowed. What I would encourage you to do is, if you're going to go out on the marketplace and you're already working with an agent, just use the agent to go out there. Nebraska is one of the states that allows agents to do that. So they can go out there, they have full access, they've had to be certified in order to get through this process, so they kind of understand how it works. It'll help prevent a lot of headaches on your end, hopefully. Although I can tell you, I wouldn't go into them today. And it has nothing to do with your agent. It has everything to do with the marketplace. It's not working very well. They're still working out some bugs. And what we've really told people is give it a couple of weeks, and let's see if they can work some of those things out. But yeah, you have the ability every year during the annual election period to change how or who you buy your insurance from.
Okay. Next question. Judy asks, if a farmer has coverage through his spouse's group insurance, the spouse's employer pays for most of the employee's premium, but none of the family. The premium for the family uses up most of the employee's paycheck. Can this family apply for a subsidy?
Potentially, yes. That's one of the interesting holes in the law is, while it requires employers to offer coverage, it only requires employers to offer coverage to the employee and their dependents. But their dependents, interestingly enough, do not include their spouse. So technically, you could leave the spouse off the plan, and they would have to go out and buy their own insurance. The other thing that a lot of employers do is just what you've laid out here, which is they only pay towards the employee's cost of insurance as opposed to the whole family's cost of insurance. So in that case, it could be, and again I say could be because I don't know your specific situation, it could be very beneficial for you to go out and buy an individual plan in the marketplace for the spouse and the kids. you may or may not qualify for subsidies. It'll be based on all those income requirements and how much of your income you pay, et cetera, et cetera. But it's certainly worth sitting down with an agent and saying, okay, here's our scenario. We see those today, even before the law, where employers would only pay towards the employee coverage, and frankly, we sell a lot of policies because it's less expensive to buy in the individual market than it is often in the group market.
Okay, next question. Karen has, have there been any studies by health insurance companies whether it would be wise for a couple, both age 56, to buy their own policy rather than as a couple?
I don't know that there have been any specific studies around, and various insurance companies are kind of handling this differently, but in most cases you are allowed to split contracts. And where that probably makes the most sense is in a scenario where either a spouse has, for instance, if you had one spouse that was very, very sick and one that wasn't, you may look at different levels of plans for those folks. Because you know the person that's very, very sick, you're going to go through a lot of claims. If you have one spouse that is consistently in the state and one that travels frequently, you may look at different plan designs for those folks in terms of, do I want to work with a limited network plan or an HMO versus something that has, nationwide coverage. So I don't know that there have been any studies, and it's really going to depend on your specific situations. And again, I hate to keep going back to the agent, but they can help you with that. And actually, you can do that too because these rates are published. So you can kind of start doing the math yourself. But I would encourage you to go to somebody that does this every day and let them help you figure it out. So.
Okay, now we're going to go to the phone or to the microphone. Linda has a question. So, Linda, I have unmuted your line. Linda, are you there? We're not hearing you, Linda, so if you could type your question in, that might work better. We have another question. This one came from Scott. He said, the president promised that he could keep his current insurance plan. Is this true, or why is it that he's not able to continue with the plan that he has had in place?
Well, if it's any consolation, the president probably kept his plan. That was probably more political than I needed to be, but what the president said was, yes, you'll be able to keep the plan that you're on. Those plans are called grandfathered plans, and it was dependent on a whole lot of things. First of all, that plan had to be in place before March 21st, I think it was, or March 23rd of 2010 when the legislation passed. If that plan was in place before that date, and no significant changes were made to that plan, and I could give you all the detail on what significant changes are, and your insurance companies allowed grandfathered plans to remain in place, then yes, you would still have the option of staying on that plan. The reality is in Nebraska, very few insurance companies did that. Very few plans remain grandfathered because of changes that had to be made to comply with other laws and regulations. So it's probably unlikely that you're able to keep the plan that you're on. Again, I can't speak to your specific situation, but if you talk to whoever your insurance company is and just ask them the question, am I on a grandfathered plan? If you are, you can stay on that plan indefinitely. If not, you will have to move to one of the new ACA compliant plans.
Okay, Linda typed her question in, and her question is, can a small employer with less than 50 employees reimburse their employees for health care premiums?
Great question. And this is one of those I'm going to tread very lightly on because I'm not an accountant. Yes, you can, but there are some very significant limitations on how you do that. What I would recommend you do is to work with your accountant and or work with somebody that administers health savings accounts, flexible spending accounts, etc. There are ways that you can do this under what's called a Section 125 plan, and there's actually ways that you can do it as the owner of the business for you and your family through what's called a Section 105 plan. And again, without knowing the specifics of everything in your in your scenario, I don't want to try to try to tell you what you can and can't do, but yes, you can. You just have to be careful how you do it. The Department of Labor and the IRS issued a reg about 3 weeks ago that kind of outlined what you can and can't do. You know, the bad news was it stopped us from doing some things that people were doing before. The good news is it really brought a lot of clarity to what you can and can't do, because there was a lot of confusion around how you could do this. So again, I'm going to send you back to your accountant. They should be familiar with this. These regulations literally just came out in September, so they're pretty fresh in everybody's mind right now.
Mary asked the question, how does the Affordable Care Act affect those who are retired on Medicaid and also carry a supplemental policy?
Okay. Medicaid or Medicare?
It said Medicaid.
Medicaid. First of all, let's differentiate. Anybody that's over 65 is probably on Medicare. Medicaid is an under 65 policy that's designed for low-income folks. I'll talk about both. First of all, ACA doesn't have much of an impact on seniors. So if you have a Medicare plan through the federal government, you have your Parts A and B, you've purchased a Medicare supplement plan, none of that really changes. There is some language in the regulations that make a few changes to the Part D prescription drug plans, and it's basically a beneficial thing for you. It reduces what's called the donut hole. So that donut hole is basically going to shrink to nothing by the year 2016. But for the most part, if you're on Medicare, there's really no impact to you. And I think that's important for people to know. There's unfortunately some folks out in the marketplace, whether they be, you know, unscrupulous agents, just unscrupulous folks that are using ACA to try to scare people into the fact that they've got to change something, they've got to get a new card, they've got to do this. It really doesn't impact anyone in the Medicare market. I do want to touch on Medicaid for a little bit because I think it's important to understand. Medicaid is a program that was designed many, many years ago to help very low-income folks have health insurance. Each state, it's a state-run program, and each state tended to have their own rules around who qualified, who didn't qualify. What ACA does is basically say everybody fits into the same qualification standards. But when the Supreme Court ruled on the Affordable Care Act, one of the things they said was the federal government cannot make a state participate in the new Medicaid program. They still can keep their old Medicaid program, and they may or may not participate in the new. And I don't want to get into all the politics of this and who did what. The only reason I bring it up is this. We have some folks, and I've heard this discussion, if I'm a farmer, I have a lot of assets, but I'm able to show very little or no income on my tax return. Will I qualify for subsidies? The reality is if you show no income on your tax return, you may qualify for Medicaid. And frankly, if you qualify for Medicaid, you will be put into Medicaid. It's not really an option. And so what you want to be careful about if you're thinking of going that route is Medicaid may not be the coverage that you want it to be for your family. First of all, you're going to find it very difficult to get doctor appointments, et cetera. But more importantly, there's some rules around, and again, I'm going to get into a little bit of tax code here that I'm worried about, but there's some rules around if you should happen to pass away. There are estate rules in terms of what the government can do in terms of recovering costs that you incurred under Medicaid or under these public programs through your assets. So again, it's something you'll want to visit with your accountant about if you think about going that route. And I just throw that out as a word of caution. But to go back and answer the question, no, if you're over 65 and you're on Medicare, there's really very little impact to you.
Okay, this question is coming from Jordan, and he wants to know, would every employer have to provide notice of marketplace regardless of size? And is this something that needs to be sent out each year? And have they indicated what the penalty next year would be for noncompliance?
It is something that every employer has to provide, and it is done on an annual basis. There are sample notices that are out there on the Department of Labor website. I don't know off the top of my head exactly what the penalties are. We can certainly look into that and try to find out and get that information out. If you actually go to the U.S. Department of Labor website and click on Affordable Care Act, it's right there, and it'll actually tell you what the requirements are, and it'll give you the sample forms. So.
Okay, next question is coming from Karen. Are there going to be in-network and out-of-network doctors, clinics, hospitals, etc., or do all health providers have to accept any insurance plan, whether it be bronze, silver, gold?
Now, that's actually a great question. The insurance plans are still written by private insurance companies. So there are no government plans other than Medicaid. So all the plans that you're going to have the option of buying are still sold by companies like United Healthcare and Blue Cross and Coventry and any of the folks that buy. So they're going to set those plans up just as they do today. And yes, you will have in-network providers, out-of-network providers, etc. What you're probably going to see even more of, however, is what we call limited networks. And that's a mechanism by which an insurance company will work with maybe an individual provider group or an individual hospital system and set up a very, very narrow network where you will enjoy the largest benefits, maybe a somewhat broader network where you'll enjoy a reduced level of benefits, and then if you go out of the network completely, you may have very limited benefits and frankly no caps on your out-of-pocket maximum. So I encourage you, and it's really no different than you do today, take a look at those provider networks as you're trying to decide which plan you want to be in, because the reason those insurance companies do that is they're able to negotiate very good deals with those provider systems. And if you happen to use that provider system and you never go outside that provider system, it could be very beneficial to you. However, if you're more interested in having an option and having a choice on which providers you see, you're probably going to want to spend a few extra dollars on your premium and have a little more freedom of choice in terms of access.
Okay, next question is from Scott, and it's how much am I allowed to contribute to my healthcare savings account per year under the new law? And for example, if I have an out-of-pocket maximum under the new law of $12,700, can I put that much back in every year?
Man, you're getting into these tough questions for me now. Basically, the out-of-pocket maximums that have been set under ACA for all the plans, whether it be bronze through platinum, are tied to those HSA contribution limits. So theoretically, yes. I don't want to say yes, unequivocally, because again, you could have a unique situation. But the reason they set those out-of-pocket maximum levels there, and again, you still have to buy an HSA-eligible health plan. Not all plans are going to be HSA eligible. So you have to make sure you buy one of those HSA-eligible health plans, and all the carriers will have them. And it's really no different than what we've done before. But yes, you should be able to do that. The other thing I would say is on the flexible spending accounts, for those of you that are in employer plans or FSAs, the federal government did cap the contribution on those to, I think, $2,500, where it used to be it was significantly higher than that. So.
Okay, next question. Would a job change but not loss constitute as a life-changing event that would allow for the special election period?
I believe it depends on whether or not you actually lose your coverage. If by changing jobs it causes you to lose your coverage, then I believe it would qualify. And I don't know that for sure. I would have to do a little bit of checking, but I think it's actually what it is not necessarily job loss, it's loss of employer coverage. It usually is because of a job loss that happens. So.
Okay. Next question from Karen. Do we have to sign up each year during the enrollment period?
If you want to change plans, yes. If you want to remain on the plan that you're currently on, there's probably nothing you need to do during that enrollment period. You'll just stay on the plan, the existing plan. The only time that would change is if for some reason that existing plan was going away, if the insurance company decided they're not going to offer that plan anymore, but you would get plenty of notification from them in that case. But no, if you want to stay where you're at, once you're on one of these ACA compliant plans, you don't have to do anything.
Next question coming from Dennis. And it basically says, I've had a Blue Cross Blue Shield policy for many years. Now I am told I can't keep my policy and the premium has doubled and the deductible has also doubled. Is that possible?
Welcome to the Affordable Care Act. maybe the most misnamed piece of legislation in the history of the United States. Yes, it's actually very possible that that could happen. And again, I don't know the specifics of your situation. What you're going to see is most of the plans, in order to fit into these bronze, silver, gold tiers, you're going to see deductible levels that go up. And the reason that is because those deductibles all roll towards that out-of-pocket maximum. I'm not going to try to explain all the actuarial reasons behind that, but the reality is you're probably going to see deductibles go up. There is no question you're going to see premiums go up. I mean, if you think about it, insurance companies are now required to accept anyone, regardless of their health status. So we also happen to operate a life insurance company here at Farm Bureau. And if we had a scenario where we could not underwrite life insurance and anyone could come and buy any plan at any time, you can imagine how much our losses would be. As soon as someone found out they were terminally ill, we would have people applying for $1 million policies, $2 million policies, and we would have no mechanism to deny them. Well, that's really the scenario that we've set up in health insurance, is there's no mechanism to deny, and there's no mechanism to underwrite. Up until January 1st, roughly 70%, 75% of the people that apply for insurance would actually be given insurance or be made an offer of insurance without some kind of a rate-up, without some kind of a rider, whatever. Today, or starting January 1st, 100% of those people will do that. So yes, we're going to see significant cost increases. I've seen various actuarial studies that estimate that impact to be anywhere from 30 to 60%. It's not a function of the insurance company trying to gouge anyone. There's very clear laws around how much the insurance company can make. Most of these insurance companies are operating on anywhere from 1 to 3% margins on billions and billions of dollars. If the insurance company makes more than that, they'll refund it to the customer. This is a direct result of the federal government saying you have to accept all comers, you have to provide all of these essential health benefits, and you have to do it on a guaranteed issue basis. I wish I could tell you no, it was probably just a mistake, but that's probably not the case, unfortunately.
Okay, we have a couple more questions here. Judy asks, do I have to apply for a subsidy each year?
I believe the subsidy eligibility is determined each year because you have to estimate your income. So yes, you would have to go through that process each year. I want to go back to that previous question. One thing that you'll want to consider in terms of if you've seen your premiums go up significantly is take a look at some of the other plans that are out there. What most of the carriers have done is tried to basically map you into another plan. They've taken what existing plan you have, and either based on what benefits you had or what premium you had or what type of plan you had, they've mapped you into a similar type plan. So if you were in an HSA eligible plan, they probably mapped you into an HSA eligible plan. That doesn't mean you have to accept that plan. You can go out and purchase any plan that's out there. In Blue Cross's case, I think they have 20-some individual plans available, and you should take a look at those other plans. Don't get caught up as much in the deductible as you do the out-of-pocket maximum, because that's really the extent of your risk. And again, if you go to an agent can help you understand that and kind of walk you through a worksheet. But don't feel like just because you got mapped into that plan that that's the one you have to accept. That's why it's called an annual election period, because you can elect any plan that you want.
Okay, the next question, Linda is asking, can an employer make payments for health insurance premiums on behalf of an employee via direct deposit or other auto pay type system?
This gets back to that question that got asked earlier. There's some limitations on what you can do, and you have to be really careful, because if you don't do it the right way, you can actually be in direct violation of not just this law, but some other discrimination laws. If you are reimbursing them through like a check, you actually, I think, have to make that check payable out to the insurance company to be able to prove that it's not income to the employee. Otherwise, the employee will be taxed on it. Again, I'm going to reference you back to your accountant because they're going to help you with this, and these laws are, I mean, they're so fresh and new that I want to make sure that you get good advice on that. But again, there are ways you can do it. You just have to be very careful on how you structure it.
Okay, next question from Scott is, why do the deductibles and out-of-pocket maximums have to be so high? Even if my premium is subsidized 100%, I still won't be able to afford the $12,700 out-of-pocket maximum included in all of the plan options.
Trying to think of the best way to answer this. Basically, the law says you have to fit these plans into this bronze, silver, gold, and platinum level. In order to do that, you're very limited in terms of what you can do. So when for instance, on that silver plan, it said you had to offer a plan that basically the plan pays 70% of the cost for the average person. The only variance allowed in that is plus or minus 2%. So in essence, those silver plans could offer between 68 and 72% coverage for the average person. Today, plans are all over the place. They're 75, 65, 55, 90, whatever it might be. But now you're limiting them to this very narrow window. In addition, because of the way the out-of-pocket maximum works, historically, the deductible did not apply to the out-of-pocket maximum. So you had a deductible that was, say, $500 or $1,000. You paid that first. Then you paid your co-insurance up to the point where you hit that out-of-pocket maximum. That's a very different plan design than what we have today, where the deductible applies to that out-of-pocket maximum. Because of that, the out-of-pocket maximums have gone up significantly, and they had to in order to fit into these metallic tiers. It's not something that any one individual insurance company has done. It's true across the board. Every policy I've looked at across the 8 states we work in has significantly higher deductibles and out-of-pocket maximums, and it's a direct result of what the law says the insurance companies had to do. So I know that's not the answer you wanted, but it's the honest one. So.
Okay, we do have another question. We are at the hour time frame, but we will continue to answer questions as they come in, and we do have one question left. But if there are more questions out there, please feel free to type that question in or raise your hand. But at this point, we would like to, if anyone does have to go, we do understand. And would like to thank everybody that was able to participate in the webinar this morning. But once again, if you want to stay on the line, we will continue to answer questions as long as they come in. The next question coming from Karen. Are health insurance companies going to require physicals before they will give you coverage?
No, they're actually not allowed to do that. They're not allowed to have any impediments to you buying coverage, whether it be physicals, genetic testing, answering health questions, etc. So no, they will not. And if you have one that does, they're in direct violation of the law, or they're selling a policy that's not ACA compliant. Now, what some health insurance companies may do is offer you an incentive to go get a physical, or offer you an incentive to go out and fill out a health risk assessment or a health questionnaire or whatever it may be, but they're not allowed to deny you coverage for that.
Okay. Are there any other questions? We don't have any other questions up at this time, but if you have a question, simply type it into the question panel or raise your hand and we will have that asked. Okay. Well, I don't see any other questions, Steve. It looks like you've answered their questions.
Well, I've tried. Hopefully we've gotten some. So, again, I would just encourage folks. It's a very confusing piece of legislation. There's a lot of changes that are taking place, and a lot of these things aren't being covered in the media, or they are being covered in the media and frankly not very fairly. And I say that on both sides of the, you can watch MSNBC and hear one thing and Fox News and hear another thing, and the reality is probably somewhere in between. But the fact is the law's here. We got to make the best of it while it's here. And the best way to do that is to sit down and kind of figure out what your options are, figure out what's best for you and your family, for your employers, for your employees, for your company, whatever it may be, and use people that are professionals to help you with that, whether it be your agent, whether it be your accountant, whether it be your attorney. The folks that work with this stuff every day are going to be able to help you with that. So with that, I appreciate everybody's time, and I hope things dry up a little bit so you can get back out in the field. So
we did have one more question come in while you were talking there. And this one is, if I have a significant other and a child, but am not married, can I cover that significant other?
It depends probably on the insurance company and what they allow to be able to be done there. There are some rules within the ACA that address that, but most of that's determined at the individual insurance company level. So that's really something you'll have to ask the insurance company.
Okay, well that looks like it's going to wrap it up for all the questions at this point. So again, on behalf of Nebraska Farm Bureau and the Nebraska State Chamber, I would like to thank everyone for joining in on this webinar this morning. And if, hopefully you are able to navigate through the Affordable Care Act. And obviously if you have additional questions, Steve, I'm sure we will have your contact information that we can email out to everyone that was on the webinar this morning. We also did record this webinar, so if there's any point that you would like to go and rewatch that, we will send out the link of where the recording will be as well. Again, would like to thank everyone one more time for being on the webinar this morning, and go out and have a great day.